Good afternoon. My name is John Russell. I was asked to come over here today to talk about healthcare reform. And as a candidate for Congress in 2006 and 2008, as well as in the primary in 2004, I have been an advocate for national single-payer healthcare. I'm a nurse practitioner by profession, and so I take care of people, and I have done so for many years. So I have a little insight into how things work. But having run for Congress, I also have a little insight into the politics of getting elected and staying elected. And our problem with healthcare is not so much that it's a bad issue. The problem is all the money that's involved. Do we really need a 1,000-page bill to ensure that everyone in America has access to quality, affordable, comprehensive health care?
No.
I don't think so. The reason it's 1,000 pages is because of all the money. As a candidate for Congress in 2006, I had the opportunity to speak with one of those Washington lobbyists that you hear so much about. And in my final conversation with this gentleman, he said to me, "John, if you're willing to play ball, work with the pharmaceutical industry, we'll get you all the contributions that you need." That's a first-hand account. This is how the system works for hundreds of people in Congress and the Senate. This is the reason why you hear people like Bernie Sanders say this is difficult, and he's one of the people that's for a single-payer health care plan. It's difficult because everyone is being bought off. $1.5 million, $2 million a week lately has been being contributed to campaign accounts through the lobbyists who are employees of corporate America. In this instance, the pharmaceutical industry, big insurance, and big pharma. Big pharma, big corporate health care. So there's a cost to providing health care. That cost is what the insurance companies don't want to have to pay because it cuts into their profits. Where we're going with this current plan, and I am not for what is coming out of the Obama administration, principally through Max Baucus and Charles Grassley and the so-called Group of Six. What I am for is an amendment to Medicare. Amending Medicare to allow people of any age to participate by paying premiums according to their ability to pay, with a cap on those premiums that would make Warren Buffett pay no more than Donald Trump if the two of those gentlemen chose to enter the Medicare for All system that I envision. But that's not even going to be talked about. That's been taken off the table before any so-called negotiations even began. What is really happening is through those campaign checks, the Congress and the Senate are being bought and paid for. All of the arguments being made in the Tea Party town halls, and I've spoken to people who are put on those tea parties, those arguments ring hollow. Rationing, it happens today, every day. I see it every day at work. How good is your insurance? Well, how do you know how good your insurance is? Even if you say, I have good insurance through my work. How good is it? Until you test it, you don't know how good it is. And that system is falling apart as we speak. Humana, laying off employees. Why? Because they've reached a critical breaking point. If they charge too much, the employers start dropping the health care. The risk is all being placed on the backs of employers and the people, so to ensure those insurance company profits. We are all in, if you think of this as a pond that's drying up, and the people with insurance, those are the people in the pond. But as the pond dries up, fewer and fewer people are in that pond. The people in the pond are concerned they're going to lose their insurance. Well, sooner or later, when that pond dries up, no one will have insurance. This is the fundamental issue that's being ignored. The current system that would be encased in concrete if one of these bills goes through, that is the likely end result of conference committees between the Congress and the Senate, is going to solidify the grip on health care in America to the system that has proven itself wholly inefficient and bloated for more than 20, 30 years. So we the people, what voice do we have when we don't elect our representatives? When it is corporate money that elects our representatives, leaving us out in the cold, leaving us to suffer with what will be. It is important to spread the word. That's why I've driven over 100 miles over here today to talk to you, and through the internet, we'll put these videos on the internet, and gubernatorial candidate Michael Arth is doing a video himself. We want to make sure that people are aware of what is going on. Not people who, like a gentleman I was speaking with, who's worried about death panels. There's no such thing. People are being fed this because the media is corporate, and the media is in the event that the president fails us on Wednesday night by presenting some Baucus, Grassley type plan, he will go down in history as the great Capitulator. He will be a one-term president if he doesn't come through appropriately on the issue of providing the American people a viable, comprehensive, affordable public option.